Hello, family. Hello, hello. How is everybody today? Want to make sure y'all can see my breast cancer pen. Hello. Hi, everybody. It is Self Care Saturday. Hello. We're going to give everybody a couple minutes to get in here. I am wearing my Deltas for a Cure because it is Self Care Saturday, but it is also Breast Care Awareness Month. So let's talk about it. I hope everybody is having a wonderful Saturday. It has been busy for me today. It has been busy, but God is good. And we are here to talk a little bit about breast cancer. So we're going to give a couple minutes for everybody to get in here. I hope everybody has had a great week and the start of your weekend. As you guys come in, just say hello to me in the chat, in the comments, so that I know that you're there and I can say hello to you. I'm excited to be with you again. I missed you guys last week. It was about family business, so I wasn't able to hop on, but I'm grateful to be with you this week. Hey, Gina, my Linkums is on. Hi, Stissy. My sister is in the building. That's really all I need, isn't it? I'd say. I'd say. We're going to give everybody a minute to hop in here, and then we are going to get started talking about breast cancer. Talking about breast cancer. So, y'all know Self Care Saturday is my favorite day of the week. I love Self Care Saturday. It's so, so, so important. And it's easy to get lost in the mix of everything going on in our lives, and it's easy to neglect yourself. Um, so, Self Care Saturday is super important. Hey, Marjorie, come on in here, Fall 97. I see y'all. Yes. It's so easy to forget to take care of yourself. So that's why I love Self Care Saturday because it's a day where we can focus. I focus on trying to do something for myself, whether that's exercising, watching a movie, doing a little spa time, whatever it may be. So love Self Care Saturday because it's just absolutely um, my time to try to do something for myself if I'm not working. So, hi, Nugget. My niece is here. Hello, hello. So we're going to get started. I am Dr. Kelly, your board certified internal medicine physician, speaker, and patient care advocate. Through my programs, I help patients become better educated consumers to improve their healthcare outcomes. I am committed to ending healthcare disparities within Black and Brown communities. You can follow me on Instagram at www.instagram.com/. Dr. Kelly. That's DoctorKelle. All of you guys are already following me on Facebook. So make sure that you follow me on Instagram and tell a friend, okay? So today we are going to jump into the topic of breast cancer, one that is actually personal for me. I have a couple of family members, people that I hold very dear, who are either breast cancer survivors or currently battling breast cancer. So, our health is our wealth. And I definitely want to try to give a little information so that we can fight and better equip our women, particularly Black and Brown women, to get into healthcare screening sooner. So, let's talk about it. So, breast cancer can occur in both men and women. So, men have breast tissue, although not as much as we do. I want to make sure y'all can see my deltas for the cure pin. Trying to make sure I keep all my accoutrement in the screen so y'all can see it. But men and women can be affected by breast cancer. It's obviously more common in women. Um, a lot of times it's identified through self breast examinations where women realize that there's something different with their breasts than what they had previously noticed. And obviously, for that to be effective, you have to be doing it on a consistent basis. But it is oftentimes found incidentally on imaging. So people come into the hospital. Or the emergency room, maybe they have a cold or pneumonia or something like that, and we find an image or find, excuse me, a a mass or a lump. So that is a common way people don't know they're there. Um, hey, Dr. Tanya, thanks for joining me, love. We are talking breast cancer today. Most cancers are found in the ducts, which is like where the milk is held. So it's a ductal cancer. And you can also find them in the glands. And that's called a lobular cancer. So we're not going to get too much into the weeds about naming cancers because it gets a little complicated. But just know that that's the two most common places that cancers are found. Um, and it can also be in other breast tissue and can present as sarcomas, which is in the muscle, and also as a lymphoma, which is in the lymph nodes. It is often spread. So it's very common for women with breast cancer to have what we call metastatic disease. And that spread is usually through lymphatics, which is the drainage system of the body, or through blood. Okay, so let's talk a little bit about statistics. So the most common cancer in the United States is lung cancer. So number one for men and women is lung cancer. Number two for women is breast, right? Number two is breast. So most common cancer for women across the board is going to be breast cancer, right? If you're just looking at women and African Americans, um, the numbers are crazy. Under the age of 45, breast cancer is the most common cancer. Okay, let that sink in. 45, under 45. Okay, so each year, roughly 42,000 women die from breast cancer. There will be approximately 48,000 new cases of stage one breast cancer diagnosed in 2020 alone. Breast cancer is the second most common cause of death in women, the first being lung cancer, right? The chances of dying from breast cancer is 1 in 32. I'm sorry, 1 in 38. Excuse me, 1 in 38. And that's approximately 2.6% of women. Um, Breast cancer is decreasing somewhat in women above the age of 50, and that's primarily due to our increased focus on screening. African American women are the most likely to die of breast cancer. Okay, African American women are the most likely of all the different races of women to die of breast cancer. Let's just put that out there, right? So that is why we're talking about this today. Asian, Hispanic, Native American women actually have a lower risk of breast cancer overall, and they have a lower risk of death, right? So that kind of makes sense. If you have a low risk to begin with, to even acquire the cancer, then your risk of death is lower, just by numbers. Um, there are approximately 3.5 million breast cancer survivors in the United States. Um, 15% of women with breast cancer have a family member who also has breast cancer. So let's talk a little bit about the risk factors. So increased age. So the longer you live, the longer or the more likely you are to develop a cancer, right? So age, if you have a primary relative, so mom, dad, parents, so mother, siblings, grandparents that have breast cancer, that doubles your risk. If you have two or more primary family members, that is a threefold increase in your risk. So family history is super, super important. Um, Most common cause of hereditary breast cancer. So someone else in your family has it, or several people in your family have it. It is BRCA1, BRCA2. Okay. And that's BRCA1 or BRCA2. Those folks who have BRCA1, BRCA2 cancers have a 70% chance have the BRCA1, BRCA2 mutation or gene have a 70% chance of getting breast cancer. So just having that gene increases your risk significantly, 70%. The BRCA genes, if you have them, tends to confer diagnosis at an earlier age. So in your 20s, in your 30s, okay? And those folks also have higher risk of getting ovarian cancer in conjunction with. Similarly, in men, if you have BRCA1, BRCA2 in your family, and you have that gene as well, it increases your risk of prostate cancer. So remember, I said the number one cause of cancer across the board, men and women, is lung cancer. So then number two for women is breast. One guess, you guys. Somebody put it in the chat. What is the most common cause for men? So if it's breast for women, what do you think it is for men? What do you think it is for men? Let's see. Who knows? Anybody? So BRCA1 in a woman, breast cancer, ovarian cancer. So in a man, BRCA1 or 2, breast cancer, and puts them at higher risk for prostate cancer. Okay, prostate cancer is the second most common cause of cancer in men. Okay, so easy to remember, right? Lung cancer for everybody, prostate if you're a man, breast if you're a woman. Okay, BRCA is actually very common in the Ashkenazi Jews. So white women definitely have a higher risk of breast cancer. But wait a minute. Who was listening? Who did I tell you was most likely to die of breast cancer? Yes, yes, you guys got it. Prostate. So tell me, who did I say was most likely to die of breast cancer? Who's with me? Which group? Throw it in the chat for me. Throw it in the chat for me. African American women. Exactly. So wait a minute. African American women are more likely to die of breast cancer, but white women make up the largest group of breast cancer. How could that be? How could that be? How could that be? Well, I will tell you. It is related to social determinants a lot of the time. Yes, absolutely. Black women. And that's because of our screening or the lack thereof. There are so many factors that go into why Black women, and actually, you can take it out of the context of breast cancer and put almost any disease state in that blank. Cancer of any kind, breast, colon, lung, any of them, prostate, men, women, it doesn't matter. It is because we tend to present to healthcare systems a lot later than our white counterparts. The key to successfully battling cancer of any kind is early detection. And so to be detected and to have those cancers detected early, you have to be screened. So whether that is having a chest X-ray if you are a heavy smoker, um, and detecting a mass that way, whether that is being 40 and going to get a mammogram, or starting your colonoscopies at age 50 or 45. It just, if you're not presenting to a healthcare system to get on a screening program, to get before a physician, then how would you know, right? How do you know you have breast cancer? How do you know there's a lump there or a mass there? Or how do you know that there's something going on in your lungs? You feel just fine, right? So that is really the primary reason why Black and Brown folks tend to present at later stages. So after the cancer has already left the primary organ. So the way we kind of, I'm going to give you like a quick and dirty as to how we kind of stage cancers. So if it is encompassed in an organ, a single organ, and has not left that organ, then it's considered stage one. If it has left that organ but has not crossed over to the other side of the body, so you have a breast mass, um, and it is in your, you know, if it's on that same side of the body, we consider that stage two. Stage three is when it's crossed over the body. Stage four, it has gone to other organs, liver, bone, um, lungs, depending on where your primary is. So that's just kind of a quick and dirty guide to how we determine how progressive cancers are. So if it's in the primary organ, it's small, it hasn't gotten to the lymph nodes, it has not spread, and it can be addressed early, you have a better outcome. So why in the world are we behind with screening and advocating for screening for Black and Brown women? So many determinants, so many reasons. There's people who are intimidated by the healthcare system. Y'all kill Big Mama. I'm not coming back here. Fear that they're not going to get the care that they deserve. That they're misunderstood, that they don't have the money to pay for it. They're underinsured or uninsured. So many different things that go into why we are screened or why our cancers are diagnosed at later stages. So all of those things are a part of the problem, and really a part of why I am so adamant about being an advocate for Black and Brown communities, because you need someone who looks like you, who understands the idiosyncrasies of our demographic of our people, who understand what you go through, what it is to be Black in this country. All of that stuff has its effects and its implications on your likelihood to get care. So I can't even tell you how many times I go in to see a patient and they're like, "Oh my God, you're my doctor," and I'm like, "Yeah, they're like, I've never had a Black doctor before. It's 2020, and there are people who have never seen a face that looks like theirs, delivering their health care. And that's sad. That really is sad. But it's also heartwarming that people are kind of sitting up and they pay attention because I look like them and they feel like they can relate to me. So that's why I find it so important for me to be in this lane doing this advocacy work, because I want people to not be intimidated by healthcare. I want them to be educated about their risk and know their risk and know going into the doctor's office, hey, it should be time for my colonoscopy, right? You should be sending me for a mammogram, right? Because even if the doctor who you're seeing is not culturally sensitive to your needs and not realizing your risk factors, if you go in saying, hey, I'm 45, you should be sending me for my colonoscopy. Hey, I have the BRCA1 gene, or my aunt has breast cancer, I may have the gene, I need to be tested. If you go in advocating for yourself, then that's half the battle. Then you just need a clinician, a doctor, a nurse practitioner, whomever, who is on your side and listening to you and doing those things that are in your best interest. So that is exactly why I am so passionate about being a patient care advocate and teaching on both sides, to patients and to my physician colleagues, about knowing how our community works, how we think, and getting these screenings done so that we aren't losing our brothers and sisters to things that our counterparts are not dying of. Okay. So let's talk about it. What can be done? What can be done? Well, first off, you have to know your family history. If you know your family history, then you kind of know a little bit about what your risks are. So if you have a family history of cancer, breast cancer, colon cancer, whatever kind of cancer, know if that's a primary relative. So your mom, your dad, your siblings, your grandparents, because those are the people that you have the most genetically in common with, right? So most likely to have similar things to them. Know what your grandparents died of, your great grandparents. Try to get some history so you kind of know what you're at risk for and what you need to be on the lookout for. If there's a family history of breast cancer, then getting your genetic screening, getting genetic counseling, having your doctor test you for the BRCA1, BRCA2 genes. Um, there's some things that you can't change, right? So whether you got the BRCA1 or BRCA2, you have no control over. You cannot pick your parents. You don't get to say what your genetic, predisposition is, right? We just get here and you meet your parents, and it is what it is. So you can't control your genes. You can't control that you're a woman, right? None of us had that choice who are female. That's not something you can control, but it does confer obviously higher risk, right? But there are some things that we can do that can lower our risk. So there is data to suggest that limiting your alcohol consumption um, can lower your risk of breast cancer. So 2 to 3 drinks of alcohol every single day confers a 20% higher risk of breast cancer. There's some data to suggest that being overweight or I should say, there is data to confirm that being overweight will also increase your risk of breast cancer. And the reason for that is specifically after menopause. And that's because the more fat tissue you have, the more estrogen you have. And increased estrogen is also linked to breast cancer. There are certain cancers that confer certain receptors, and estrogen and being an estrogen produce cancer is one of those. So that's something we can do something about. Regular physical activity. The American Cancer Society is currently recommending about 2 to 3 hours of moderate exercise a week, or 75 minutes to 150 minutes of vigorous exercise every week. Um, Obviously, self breast examinations. Now, this is a little bit tricky because it's recommended, but it doesn't necessarily confer any benefit to folks who do it, because a lot of times people are inconsistent, not doing them every month. I'm guilty. I'll say that right off the bat. It is difficult to remember to do that every single month, but it is a tool that could possibly increase your detection risk, or your ability to detect a mass or a lump. Because if you feel something and you go to your doctor and they're like, oh, hey, let's go ahead and send you for a mammogram, or let's send you for imaging, and you detected something and it's something that's malignant or actual cancer, then you found it early. Whereas maybe your screening wasn't due for another year or two, right? So, when it's done correctly, it's done consistently, it certainly does not hurt, right? But mammograms and MRIs are definitive ways to get good looks at the breast tissue to find lumps and masses. And not every lump that's found is malignant or cancer, but you definitely need it to be biopsy to determine whether or not there's cancer there. So we will get into a little bit about mammograms, but I hope the take home here is that early detection is key. So whether you are, try put a reminder in your phone, certainly getting annual checkups either with your primary or your GYN doctor, and making sure that breast examinations are a part of that, and certainly keeping your eye on the clock, making sure that depending on what your risk is for breast cancer, that you are on par with your screenings. So, um, one thing about mammograms is that the denser your breast tissue is, or the fuller your breasts are, sometimes it is harder for the mammogram to actually pick up a mass or a lump. And so it may or may not be the best modality depending on what your breasts are like. So the more dense they are, the easier it is for something to be missed. So those patients may do better getting an MRI than a mammogram, so that the entirety of the breast can be examined and seen, right? So we will get into that, into our mammogram recommendations. So presently, if you have average risk, meaning you don't have a primary relative that has breast cancer, you don't have any personal history, and you don't have any genetic predisposition such as BRCA1 or BRCA2, then you are considered average risk for breast cancer. So currently, the guidelines state if you are 40 to 44, you have an option to start doing annual screening. So your insurance will technically start covering annual mammograms 40 to 44 for people who have moderate risk. So, no family history that you're aware of, no personal history, and you do not have BRCA1 or BRCA2. 45 to 54, annual screening for everyone, regardless, okay, of history. If you are 55 and older, the recommendation is for every other year. However, women who would like to can still get annual screenings. And the recommendation is to continue to get mammograms if as long as your life expectancy is 10 years. So if you're 89, you probably don't need a mammogram. Okay. If you are 59, I would say you have a pretty good chance of making it to 69. You want to make sure you're getting at least getting your mammogram at least every other year, if not every year. Okay. So that's for our folks that are average risk. For our high risk, this gets a little trickier because the nuances will determine what type of modality, whether you get the MRI versus a mammogram and an MRI. So your doctor will have to make that determination. But essentially, high risk patients are anyone with a family history. If you have known BRCA1, BRCA2, you have a first degree relative, so mom, dad, dad's count, mom, dad, brothers, sisters, grandparents, any of those folks, or if you've had radiation to your chest, age between the ages of 10 and 30. So that would be like our asthma patients, those folks who typically go to the hospital a lot, with asthma exacerbations. They always get a chest x-ray. So if you're a person who grew up and you had terrible asthma, you've been hospitalized multiple times, and you've had multiple chest x-rays, they're at higher risk of breast cancer. So you definitely want to get screened more frequently and more aggressively because of your radiation exposure. So anytime you get a chest x-ray, that's radiation. Okay, so that's really important, especially like for my moms and dads that are watching. So even though you're like, we don't have a family history, if your baby, if your child has asthma, don't forget that that confers higher risk for them. So anytime you radiate any part of the body, it has the potential to um, start abnormal cell growth. So if you ever notice in the hospital, anytime we're giving chest x-rays, all of us step out of the room, right? And if you have to stay in the room, everything's covered. Your neck to protect your thyroid, your chest to protect everything that's in your chest. They usually have on a full iron apron. That's the reason why, because continual radiation puts you at cancer risk. Okay. So um, you really need to discuss your risk factors with your physician. This should be a part of your annual screening. And for our diabetic patients, our patients with high blood pressure, folks who are seeing a doctor every 3 months for various conditions, do not neglect your cancer screening. Okay, so we talked about colon cancer here recently. The age there is 45. Unless you have a primary relative who has colon cancer, then it's 10 years before the age of their diagnosis. So we can revisit that if need be. Please let me know if y'all have questions about that. But breast cancer, any cancer really, is very tricky, and there's all these little nuances that go along with that. But just I'm putting the information out there because I want you to be able to go to your doctor and say, hey, I'm turning 45 next year or next month. When can we schedule my mammogram? When can we schedule my colonoscopy? Because even though your doctor should be bringing these things up, should be talking to you about these things, they're human and they may miss things or they may forget or whatever the case may be. But if you are bringing it up, then it shows that you are prioritizing your health. It shows that you're engaged, and that's an awesome thing. Everybody needs a little nudge every now and then. Most of the EMR systems, the electronic medical record systems that we use, automatically prompt your doctor to ask you about certain things based on your age, whether that's a pneumonia vaccine, the flu vaccine, your tetanus, whatever. Most of the EMRs do that. But I want to empower you guys to go into the doctor's office knowing what you should be getting so that you're not waiting on them to bring it up. You're showing them that you're engaged, that you come in with expectation, that no, my health is my priority. I know what I'm supposed to have. Let's be about it. Let's get that done. Go ahead, put the referral in, So again, let's just recap really quickly. And I will say I don't do breast cancer any justice, really, or any topic, because there's so many nuances that go into all of these things. But I just want to kind of prick your heart about these topics so that it reminds you what you need to discuss with your doctor, what you need to be on the lookout for. And again, my end goal is always to put you in a position to be able to advocate for yourself, just in case your doctor is not doing those things. Okay, so we talked about breast cancer today. October is Breast Cancer Awareness Month. We need to be aware of breast health every month, obviously, because we need to be all year long, making sure that we're taking care of ourselves. I'm wearing my little deltas for the cure pin. Can y'all see that? All right. So let's be about it. Nudge a sister friend to remind her to get her mammogram if she has not. Ask her about it. Hey sis, are you getting regular mammograms? Have you had one this year? Especially if they're 45, getting close to 45. So that is breast cancer, kind of in a little nutshell. It's obviously very complicated. Can the treatments are very complicated, and the goal here is not to really give so much education about the different cancers. It is more so about making sure that we get screened and that we drag a friend, take your auntie, take your niece, whomever, so that we can lower these numbers and lower the mortality rate for Black and Brown women, because African American women are absolutely presenting late to healthcare settings. And I would love for us to, our numbers to mirror our Caucasian sisters' numbers. So, with that being said, enjoy the rest of Self Care Saturday. I hope you guys do something amazing for yourselves. Hey, Sarah Tanya, thank you. Thank you so much. Thanks for joining. Please like and share this video. Somebody in your life, somebody on your timeline needs this information. It's something they haven't thought about. It's something that is on their list of things to do. They just haven't gotten there yet. So please share this information. I am Dr. Kelly, your board certified internal medicine physician, speaker, and patient care advocate. Through my programming, I help patients become better, educated consumers so that they can improve their healthcare outcomes. It is my goal to decrease healthcare disparities in Black and Brown communities. Please like and share this video on your timelines, because somebody in your life needs this information. Thank y'all so much for joining me. I love you, and I will see you guys next time. Have a great rest of your day.